What is the history of lung cancer imaging? Imagine how far we've come in spotting lung cancer early enough to make a real difference. The story begins in the 1960s and 1970s with simple chest X-rays and sputum tests. These tools were the first steps in trying to find lung cancer, but they had limitations. Chest X-rays could only give a flat, two-dimensional picture, which made it hard to see small or early tumors hidden behind other structures. Sputum cytology, where cells from mucus are examined under a microscope, was helpful but not very sensitive for early detection. Despite their widespread use, large studies showed that these methods didn't really cut down on deaths from lung cancer. Then came the 1990s, a time when computed tomography scans, or CORT scans, started to change the game. Early CTs used thicker slices, about 10 millimeters, which gave more detail than X-rays but still missed tiny nodules. These scans produced cross-sectional images, allowing doctors to see slices of the lungs from different angles. It was a significant step forward, but the images still had some limitations in resolution. The real breakthrough happened in the late 1990s and early 2000s with the development of low-dose computed tomography, or LDCT. This technology uses a much lower amount of radiation but creates incredibly detailed three-dimensional images of the lungs. With LDCT, doctors could spot very small nodules that were invisible on traditional X-rays or earlier CTs. These scans produce hundreds of thin slices that can be viewed from different angles, making it easier to identify early-stage lung cancers before symptoms appear. Large clinical trials, like the National Lung Screening Trial, helped prove the value of LDCT. They found that annual screening with LDCT in high-risk groups, especially heavy smokers aged 55 to 74, reduced lung cancer deaths by about 20% compared to chest X-ray screening. This evidence led to LDCT becoming the standard screening tool for people at high risk. Since then, technological advances have kept improving lung cancer imaging. Multislice scanners and computer-aided detection tools help radiologists interpret scans more accurately. Modern protocols now consider factors like the size and growth rate of nodules to decide whether further tests or follow-up are needed. These improvements aim to catch cancers early while avoiding unnecessary procedures caused by false alarms. In summary, lung cancer imaging has evolved from simple X-rays to sophisticated low-dose CORT scans that can detect tumors at much earlier stages. This progress has been vital in shifting the focus toward early diagnosis, which can lead to better treatment options and improved survival. Always remember, if you have concerns or risk factors, talking to a healthcare professional is the best way to understand what screening options are right for you.